There seems to be a lot of interest in brain aneurysms all of a sudden, based on the reports of Kim Kardashian having a brain aneurysm. So let's talk about this and set the record straight on a few things. Per the news, it seems like Kim Kardashian had a routine brain MRI, and that's how her brain aneurysm was discovered. So first of all, there's no such thing as a routine brain MRI. Okay, normal people don't get a routine brain MRI. We get brain MRIs if you have headaches, if you have dizziness, if you have some kind of focal neurological deficit, right? Routine brain MRIs are just not a thing. Okay, so let's move past that. Now, in her brain MRI, it seems like she had a brain aneurysm, and she is attributing it to stress. Let's talk about this. There's a lot of research and literature on the causes of aneurysms, right? And the top three proven causes of brain aneurysms are hypertension, so high blood pressure, smoking, and some genetic factors like Ehlers-Danlos syndrome, autosomal dominant polycystic kidney disease. However, stress is not directly a cause of brain aneurysms. You could argue that stress can indirectly cause a high blood pressure, right? And it can maybe make somebody start smoking, right? So all of those are possible. But again, directly, stress is not going to cause brain aneurysms. The other thing is also that most people these days are very stressed out. You know, if stress was a cause, then everybody would have a brain aneurysm. However, only 3% of the population actually has a brain aneurysm. Now, what do we do with this information once we know that somebody has a brain aneurysm? If the aneurysm is less than 7 millimeters, then it has a lower risk of rupture. So for those, usually we just monitor them. We get a brain scan once a year. So that would be a CT angiogram or an MR angiogram to look at those blood vessels and monitor the size of the aneurysm, make sure it's not growing. If it's larger than 7, then that seems to be the magic number that puts patients at risk for rupture. Now, what happens if an aneurysm ruptures? Basically, it leads to what we call a subarachnoid hemorrhage, which is a specific type of brain bleed that is very high in mortality and morbidity. And patients usually end up in neuro ICU if that were to happen. I hope that this has clarified a few things about brain aneurysms for you. If you got any questions, comment below.